It's my pleasure and privilege to have you again here today in my office. How are
Nice
you?
to see you again. Thank you.
Okay, you are smiling, and I suppose that because you are smiling, you prepared something interesting to ask. What do you have in mind?
I would like to talk today about dietary supplements, whether they are needed at all or it's just perception that they're like helpful. Sometimes you go into pharmacy, you see so many supplements, and some people buying them, some people saying, it's just imagination, it's just TV advertising. And some people just saying we are on a diet and they don't use any supplements and they're okay. But some other people using tons of supplements and they're not okay. So first of all, do you support using supplements for any kind of diet?
Well, I'm glad you asked this question because this is a very common situation when a patient comes to my office and opens his bag. It's literally the whole bag filled with supplements. And he's taking all of them.
Wow.
All of them. And he is asking, or he or she is asking, doctor, what do you think? That's the first question. What do you think?
How helpful, how effective?
The second question, why I'm taking all of them, so many of them, and I'm not getting better. That's the second question. Okay.
And what is your response?
It's a very common situation, and unfortunately, I deal with this almost every day.
Wow.
Almost every day. Yeah, that's very common because what they usually do, they go to a natural health store and they ask pharmacist or whoever is what to take, and they grab all of them and start taking like 10, 12 pills a day. And they think because the thinking behind it is very simple. So they're trying to get as many supplements, thinking that at least one of them will
be working.
Yeah.
But I think it could be counterproductive. You take all of them, it can hurt you. Too much, no?
Well, that's the second question, but I'm just trying to explain you why they do it. They're not that stupid. They're just trying to, when you need to attack an enemy, you can either use a sniper, a rifle, or use a grenade.
Okay, so they're using grenade.
Yeah, they're using grenade. Okay, they think they are using grenade. But sometimes grenade works against the person who threw it, And that's what happens is that in this case, because they take a lot of them, it doesn't mean that at least one of them will work and they will achieve the goal they want to accomplish.
So as I understand, you prescribe specific supplements. If they're useful, you saying take only this one, correct?
I am trying to be as specific as possible. But my point is that when they take a lot of supplements, they can take a supplement that that can actually hurt and spoil everything. Supposedly they use some useful supplements, but some of the supplements may be harmful. What I have seen. I'm not talking about different experiences, but what I have seen is most of the person they can have liver damage, and most likely it's the Chinese herbs that are the reason for that. That's the most common reason for that. So basically what happens is that Chinese herbs can damage liver and it spoils everything. It doesn't matter what they're taking for the rest of the supplements. And unfortunately...
So when someone opening and showing to you, you're saying, do not take any of them, or you say, you know what, this one is good, but the rest you don't take. Or you say, don't take any of them.
Well, it depends, because what we try to do is to do investigation first. I usually don't look at the supplements and just give, it's not...
First you take a blood test.
Blood test, we do sonograms, we do a lot of things.
And then you decide which one is useful.
And yes, and most of the time what we find is that supplements don't work because of very simple reasons. They are not absorbed. Once again, I keep saying the same thing. If somebody puts a pill in his mouth, it doesn't really mean that this pill goes into his system. It happens to the supplements quite often. And first of all, let's think about.
So you're not against all supplements in general. You're against senseless use of them.
Exactly. Exactly. And once again, why there are several reasons why supplements may not work. First of all, it may be wrong supplement. Okay. Second, the dosage may not be enough. Not enough.
Not
enough. No, let's talk about supplements. So let's talk about probiotics. Just we try to use as powerful probiotics as possible. It's supposedly somebody comes to the health store and takes 2 billion or 5 billion probiotics strengths. It's not going to work because we use up to 800,000 billions column twice daily. So it just cannot be compared to some of the brands that are sold over the counter.
Then why do they sell such a small amounts?
Well,
why not sell?
Listen, I'm not a manufacturer.
Okay.
That's why I really can't tell you. No, I have some idea why it might happen. Is that because if you're using something really that is really working, it is likely that you will get some side effects. Nobody wants side effects.
Correct.
It's better sell the pill that is harmless, and that's it. At least they're not going to do.
So you're saying some supplements can have side effects?
If you use it in high dosage to achieve the effects, yes. Yes, it happens. Because if you're using something really powerful, you can't make it totally 100% safe.
In most of the cases, people are taking the supplements to lose weight, to become more calm, or what is the usual reason to take supplements?
No, the reasons might be zillions, but let's concentrate on why they fail. Why they fail? Because it would be too simple. Why they fail? Basically, most of the time, the reason why they fail is because of they are not persistent enough. Because supplements and dietary interventions, they are not designed to fix the problem
right away.
No.
So it's persistence and it should be long period of time.
It should be a program.
Decided, prescribed by the doctor?
I'm sorry?
Prescribed by the doctor? Who decides the longevity of the program?
How long is the program is?
Yeah.
It's better to do it over the doctor's supervision, of course.
Not pharmacists.
No, I don't think so. Because once again, you need to understand it's long-term management. It's not short-term management. It's a long-term management. And why people fail most of the time, they think they take a supplement pill and get better next day. No, it's not going to work.
Doesn't work this way.
And that's why what we do, we put the patient on a program. And basically the program consists of several stages. Okay, the first stage is to figure out what's going on.
What is the typical longevity of the program? 3 months, 1 year?
No, at least 1 year, and basically what I think is it should be lifelong. Because let me ask you a question, it's a very simple question, hypothetical question. You live in an apartment, house, or whatever it is. You're not going to clean your apartment once, or it's once for 3 months and that's it. You're going to do it all your life.
All the time.
Yeah, the same thing is here. You can't stop taking care of you in 1 year or 2 years. So you can't say that I am doing healthy lifestyle for 1 year and then I will go back and do the
go wild.
Go wild. No, you can't do that. It's like I am honest person for 1 year and after that I will become a criminal. The same thing is here. You can't do it. You can't do it. Either you're adherent, you stick to healthy lifestyle, or you do quite the opposite. But you can't do it for a little while.
You cannot cut corners, I would say.
Right. Yes, exactly. Cutting corners, it's very common situation. Supposedly, I tell a patient just to stay gluten free.
Okay.
And patient comes 1 month later and they said, "Are you gluten free?" And I ask, "Are you gluten free?" And the patient says, "Most of the time, yes, almost." almost, and I usually say, it's like a woman. A woman cannot be almost pregnant. Either she's pregnant or she is not, but nothing in between. The same thing is either you're
free or almost.
You're not.
Not almost.
You can't be almost. That's the same thing as here.
So I wanted to talk about one more supplement, dietary supplements that I found in your office actually, called Catecholacalm.
Yeah, so that's a very interesting thing because
First of all, I want to show it to our viewers. This is how it looks. And you can get it in your office. Yeah, correct?
Okay, so I will just briefly talk about that because I think that's the topic of separate discussion.
Okay.
But that's a very good supplement, and what basically we do is that we treat conditions that are opposite to low adrenals. A lot of people think that the low adrenals can be mostly low.
Correct.
And patient comes and says, "Doctor, I have low adrenals."
Very low, yes.
And help me with low adrenals.
Correct.
But sometimes they can be high. Can be high. I mean the situation when the patient has too much catecholamines, like adrenaline, noradrenaline, etc., etc. It's a very common situation, and it makes a person nervous, always agitated, always
too emotional.
Too emotional, right? And that can harm a lot. So why is it dangerous? Because it puts too much pressure on heart, vessels, brain, etc., brings blood pressure up, and that's what we don't want to happen.
And this helps.
Catecholamines, really, the catecholamines, that's what they kill. Why Americans are having more problems than, say, French or Austrian, because in America we have very hectic lifestyle. Too much catecholamines.
Stress.
Yeah, so we need to reduce that, and that's what we do. And this is a very good supplement. It's called Catecholacalm. Catecholamines means adrenaline, noradrenaline, and calm means put down. Okay, and it's a very good supplement. It contains taurine, which calms down person. L-theanine, it's very good. Such a very well-known herbs like ashwagandha, valerian root, passion flower,
valerian root
sounds
familiar.
Valerian root.
Valerian root sounds very familiar.
Yeah.
So you're saying it's like one capsule a day, 2 capsules?
Yeah, 1 or 2 capsules a day, but it helps to calm down, and especially such important ingredients like magnesium, pantothenic acid, taurine, L-theanine. Have you ever heard about taurine? Well, but it's a very well-known thing. See what they use taurine, by the way, for your knowledge, in energy drinks.
Oh, okay.
You know why? Because if you give a person caffeine too much, they will feel jittery. So in order to calm this person down, they use sedatives, like small sedative, like mild sedatives like taurine with caffeine.
So 90 vegetarian capsules, so it's for could be for several months.
Yes, over several months supply.
2 months.
And I always try to just make sure that my patient understand. Too much catecholamines can kill you. That's what kills. Okay, and I don't really know what is more dangerous.
How often you prescribe it? How often?
That's less often that adrenal support. Less often. Not that awful, because low adrenals, yeah, they are much more
complaining about low adrenals.
Much more often. We see in our practice high levels of catecholamines. We see less often, but that's what we do. We try to bring it down with those things, and it works pretty good.
And is it true that this is mostly for men?
Oh no. There's women, they have high catecholamines, especially who is premenopausal or menopausal, their catecholamines go tremendously. And
so it's for everybody.
Yeah, it's for everybody. Not all the time it works, but it works very well because they have such powerful ingredients like taurine, L-theanine, magnesium, and it put in a way that it's highly, it's easily absorbed. And that's, I think, the one of the advantages of this medication.
So coming back to dietary supplements story.
Once again, you can't use it for a couple of days.
Yeah, I got it. Even here is like almost 3 months, you know,
Yeah.
so
you should be persistent, and persistence is the most important thing. Just make sure that always tell a patient that you stick to the program. You have to do it step by step. It's step-by-step approach. It's not one shot. You can just do it one sniper shot, maybe in movies, yes, but not here.
and from what I understand, it could be several supplements, not just one.
Yeah, but what I'm trying to say, you need to stick to the program. Program is for years. It's not for a day, it's not for a week, it's for years, and that's how they achieve the results they want.
And the first step again, what we always talk to you about, first is a proper diagnosis, a full analysis of the situation with the patient, like blood test, maybe like cardiogram and everything
Yeah,
else.
different tests, but
All
you
kind
need
of
to
tests,
know
but
what you're dealing
to
with.
know what's going on before you prescribe or decided on a program.
Yeah, because you know, that's very common, that I told you about the Chinese herbs. A lot of patients, they come and we do the regular blood test, and they say that you have liver issue. And I say, really? Why? Why? Because you are taking supplements without
Checking anything
checking anything, you know, what needs to be done. And that's pretty much it.
So basically the conclusion is, again, be careful, check with doctor, start
Right.
with proper diagnosis, and you're not against supplements,
No.
you just want them to be taken
Properly?
properly for a long period of time,
Stick to
and
the program.
and this particular supplement, dietary supplement, Catecholacalm, is
Yeah.
for people who have a very
levels of
high,
adrenals.
yes, adrenal, correct?
Adrenal hormones.
Adrenal hormones.
Okay, so that's pretty much it, but I think the Catecholacalm we are going to discuss in a separate discussion because it's a very interesting topic when adrenals are actually high, not low.
Yes, in this case,
Not everybody knows about that.
yes.
Okay,
Thank you very much.
my pleasure, and see you next time.